Welcome to another episode of Dental Talk 360, where our focus as dentists is to make dental topics more accessible and more interpersonal to our patients. In this episode, we want to begin speaking a little bit about all different options you have when you come to a dental office for dentists to help restore your teeth. We would like to speak about crowns, fillings, veneers, inlays, onlays, and give you more information about each type of material. So let's talk about crowns. In which instances would a patient require a crown, and what is a crown?
So a crown is a porcelain restoration that covers the whole tooth, not a partial, but the whole tooth. And it's to protect the teeth 360 degrees from wear, from any sort of infiltrant that could go inside and cause caries, especially depending on the amount of destruction that the cavity or fracture caused to your tooth. At that point, you decide that you need a crown. Not every instance do patients need crowns. In one instance, some patients may need what's called an inlay or an onlay, which is where the trend is going towards more now in restorative dentistry in order to preserve tooth structure.
Instead of a filling.
Correct. Mm-hmm. So Dr. Sanchez, can you talk to us a little bit about like inlays and how are they different from like a crown restoration or a regular filling restoration?
Okay, so first I wanted to talk a little bit more in retrospect regarding the crowns. So crowns were, like Dr. Fetty said, it was going to be to cover the whole tooth. It was mainly done because back in the day our cements and our different type of materials were not as strong as they are now. Mm-hmm. So by creating this cap that goes around the tooth, it had some retention and resistance, meaning that it was less likely to come out of the mouth. So that's very, it's more outdated. Nowadays, we're leaning more towards porcelain restorations that are more conservative. So going into the realm of inlays and onlays. So essentially what an inlay and an onlay is a small restoration that we remove, like Dr. Ferdi said, we remove what's destroyed in the tooth, what's decayed or any fracture lines. And then we scan this tooth or take a regular impression and we'll fabricate the piece that goes on the tooth like a puzzle. So nowadays with us being able to cement better, we can create more conservative restoration, leaving the most amount of tooth because tooth structure, like we mentioned before, is the strongest material that we have in the body. So the porcelain restoration is going to enforce the tooth, but at the same time, it's going to be more conservative, leaving more tooth structure for us to cement the restoration and give back the strength that the tooth lost by losing so much of its own.
And what are some of the benefits, Dr. Bart, about having an inlay or an onlay as opposed to, like, say, those older techniques where they were a little bit more invasive in removing more tooth structure and doing an onlay and inlay? What are some of those benefits for the patient?
So I always tell a patient, I preface it with the fact that nothing lasts forever. But I'm a young dentist, we're all young dentists, and we want to see our restorations last as long as they can. So when we're very conservative and we prep the teeth, we're minimal. In the future, if there needs to be a replacement, a revision, then we can go back in and just move a little bit more than it was before. Then when you prep the tooth for entire crown, you're really not left with much clinical, crown to restore at that point. So if we prep it, we start with an inlay, last 10, 15 years, then onlay, 10, 15 years, crown, 10, 15 years. I mean, you go down a good cycle. Whereas, okay, crown, 10, 15 years, extraction, 10, 15 years, implant, bridge. I mean, it's a vicious cycle. Nothing lasts forever, but it's nice to tell the patient we're going to be as conservative as possible. And we're going to, keep our fingers crossed. You're going to come in every 6 months, every 3 to 4 months for your hygiene maintenance. And we're going to make sure that these restorations last as long as they can.
Yeah, and to piggyback on that, so with inlays, it's say a patient has a smaller filling, for example, that keeps chipping or wears at a faster rate. And they're worried about, I just got this filling done and now it's 3 years and I got to replace it. The beauty about an inlay is that it's a smaller restorative filling, similar to the resin-based ones, but they don't wear as quickly. So they last longer in the mouth. And you could bond them and they have a very intimate contact, so they're very, very tightly sealed. So it lasts 15 to 20 years, as Dr. Santos was mentioning, and it's very, very conservative in the sense that you didn't remove as much tooth structure. For an onlay, though, that's when patients have severe fracture or more caries was done or a cavity in that sense that caused the tooth to be destroyed more. Now you need more surface of a restoration. And that is really the difference. An inlay is normally two surfaces, meaning that it's just a couple parts of your tooth as opposed to half or 75% of your tooth, whereas a crown is 100% of your total tooth structure that gets restored, right? So that way, everything's sealed, everything's protected, and with those porcelain restorations, they have less wear, they have less ability of getting fractured. And for you as a patient, it's smoother, it looks more lifelike, it won't stain. Right? A lot of patients will complain, oh, that filling that I could see is getting darker. I could see the line where the filling meets my tooth. And with the advances in color and in porcelain structures that we have now, we have such an array of different porcelains we could use nowadays to restore a tooth to give it vitality, strength, and color that it really, really helps in that sense.
And I think that as far as patients, don't get so caught up in fillings or crowns or the main thing that you should be aware of is just having a dentist that is conservative in their preparation. So remove what's damaged only, leave the most amount of tooth left. And then by having these types of restorations that nowadays we use a scanner to scan them, we can measure them, we can create them in a computer. Now you're getting exactly what was damaged to replace that tooth. So there's a lot of studies that have inlays, for example, not just the studies where the inlays is bonded to the tooth and they try to put pressures to try to break it. And usually it's not the connection between the inlay and the tooth, it's actually the tooth that breaks.
And inlay is that smaller filling, right?
It's a
that smaller
filling.
porcelain filling.
Exactly.
Right?
It's a porcelain that just goes inside
Like
the
a
tooth,
jigsaw
leaving
puzzle.
all the walls kind of around it. While the onlay covers one of the cusps. That's why it's called onlay. So it has a cusp that is involved. The crown is just, like we mentioned, 360. So in general, just have a dentist very conservative. Like Dr. Barr was saying, you always have to have a plan B. So every time I tell my patients, you're getting this small restoration, well, in whatever 10, 15 years, it's going to fail. At some point, something is going to happen. We're going to have to replace it. Now I can take it to that larger inlay or that onlay or whatever it needs to be. But you just need to go to a dentist that is aware of this type of materials and that uses them on a daily basis because they're also very difficult, way more difficult than a crown to do. It's more technique sensitive. And then also to match the color, it can be done, but it's also more technique sensitive. You need to take more photos. You need to have better relationship with a lab and use a lab that also can handle this type of restorations. They're actually harder than regular crowns.
And there's many instances in which regular filling is beneficial for a patient. It depends on the amount of tooth structure that is removed as well. And so inlays and onlays are recommended by our patients, by our dentists to our patients frequently. And so when a dentist recommends an inlay or an onlay to a patient, you should know that it's for the best interest of the patient. And that's why we're doing this talk. We really want to have you guys understand what these different materials are and when they are indicated. A regular filling is very beneficial in certain instances where there's less tooth structure removed. Now, one con of fillings is that over time it can shrink. And so that's why when a majority of a tooth structure is removed, in order to replace the strength and prolong the life of the tooth, that's why we recommend restorations like this. So let's talk a little bit about composites and what is a filling made out of. I think a lot of patients do have these questions. We mentioned porcelain and different stronger materials, but a filling, since it's not porcelain, it's made out of resin. So we can talk a little bit about what we know about resin and it's the pros and cons of resin.
Yeah. For me, you have to have a lot of armamentarium when you're dealing with certain situations. So if I see that a restoration is fairly small, not as big, and I think the patient will benefit from a filling because they're not severe clenching grinders. We as dentists try to look at the entire mouth comprehensively.
Mm-hmm.
So if there are not that many wear factors, patients isn't high caries risk, then filling may be suitable at that point.
Especially if it's their first filling or their first cavity ever.
Exactly.
Yeah, so like my protocol on this is on fillings, it will be a first time cavity that the tooth has, small. Mm-hmm. Usually I like to keep my fillings to once, so the top surface of the tooth. Sometimes when you have the contacts between the tooth, that's what strengthens your tooth. So once those two contacts are gone, the strength of the tooth decreases a lot. So whenever I have only one contact, I like to do a filling if it's small. If I have on both sides, also if it's small. My keyword is always small. If you have a large filling that failed, I always tell patients, why am I going to replace it now with an even larger filling that's also going to fail? So that's my cutout. It's just, for me, fillings are just small cavities. First time tooth has decayed that is reasonably small. Since this material, like Dr. Silvestrini was saying, it tends to shrink. Usually when they give it that little blue light, the property of the resin is that it shrinks. It doesn't seal the tooth as well. It creates a small gap between the tooth and the restoration material where bacteria can infiltrate and cause what we call secondary decay. It also can put tension on that wall of the tooth because now the resin, when you bite on it, over time is going to wear off. So therefore, what's going to hold the force of the tooth are the small, tiny walls that you have. If the restoration is too big, those walls tend to be smaller. So the typical patient walks in, the tooth is fractured, they think it's a filling, it's actually the part of the tooth that came off, the filling is usually intact. Sure. So,
yep. And dentists pay a lot of attention to function. It's really important. Also, we are talking about restorations that are primarily used on the back teeth. Now, the front teeth shouldn't normally take as much force. But in instances where we do need to put a crown or a veneer in a front tooth, it's with excellent care, and we also choose the material accordingly. If you get a filling in a front tooth, typically if it's in an aesthetic area, can also discolor over time. So a lot of patients don't know that, and as well, it depends on the patient's function. So if you are a grinder, if your bite is not as it should be, those are things that your dentist should take into consideration when choosing a material.
Yeah, because your front two teeth, what they do is that they shear. So kind of like scissors. Right. So a lot of the issues is that resins that are manufactured today have great compression. Right. So that when you're chewing in the back teeth, they're excellent at compressing. But they're not good at the exact shear part of it. So a lot of complications that we'll face is that a patient will be chewing and all of a sudden that front filling flies off or debonds, as we would say. And the reason for that is that lack of shear strength, right?
Exactly.
Meaning the scissoring of which is what the front teeth do. So some of the recommendations that I'll have for those patients that have a minor filling in the front is to avoid eating hard materials, ice. Some patients like to chew ice, or some patients that like to eat hard, crusty baguettes with their front teeth.
Chew their nails.
And then chew their nails or chew on pencils. So they have to be very careful with their oral habits in order to prevent things from breaking or debonding, which will lead to a different type of restoration, such as veneers and crowns down the road. Because as Dr. Santos mentioned earlier, there's always going to be that tunnel effect where things will just get worse and worse and worse over time. Yeah. So, and those fillings will stain. Yep. They will change color over time. Whitened. They will wear. So depending on how your mouth moves as you're chewing, we call it the envelope of function, meaning that your mouth doesn't chew like an alligator. It's not up and down. It's a whole motion, right? So you have to consider all those factors, and your dentist, when they're restoring your teeth, need to look at that whole movement in order to prevent it from fracturing, and also to decide on the material that's right for that patient for that typical either fracture or cavity that they have in order to restore it or fill it properly.
And also the age. So when we talk about age, it also depends on what happened to the patient. So when can you choose a veneer versus doing a restoration in resin? So if the patient is younger, we typically like to, and we're talking about younger, less than 21 to 23 range, we typically like to do it in resin because this person is still developing, their face is still growing. So you don't want to put a definite restoration on this patient at this point. So, and then also the patient has to understand that this filling over time, like we've all mentioned, is going to stain, especially, you know, if you drink wine, if you drink coffee, things like that. Tea also is going to cause some discoloration that is going to be more noticeable as the time passes.
Yeah, we want to make sure that we maintain the strength and vitality of all the teeth that we work on. We talked a lot about resin, so a little bit more about veneers. I know our first episode was heavily about veneers. I think that veneers can also be a very excellent option depending on the case scenario. When we do veneers, we can also actually do them extending to the back teeth. A lot of patients don't realize that. Crowns are 360 and veneers are more 180, and they do wrap around partially behind a tooth. So when we work on patients who also require veneers in the back teeth, typically we can also work our way towards doing also inlays and onlays in conjunction with veneers to when we're doing more small design cases, full mouth reconstruction. So let's talk a little bit about those cases in which we would recommend getting veneers in the back teeth and inlays and onlays in addition to veneers in the front teeth. So let's talk about how that all comes together.
So when you're looking at a smile, we have in a photo, we look at the shadows in the back. And sometimes one of the biggest issues that you'll get if someone does 6 veneers in the front is that then the back is collapsed or pushed inward. And when you look at that photo, what it does is it looks like it's dark in the back. So a lot of people want a broader smile. So in instances where a patient doesn't want to do Invisalign or orthodontics to bring those teeth out to enhance that, or let's say they're discolored, the veneering of the back teeth help expand that corridor, which then broadens the smile completely. Am I correct, Dr. Barton?
Yeah, so typically when patients come in, especially when they're older, that negative buccal space, that corridor in that area, you see a lot of distance in between there. So what we'll do is we'll build out that buccal corridor, and it'll help support the lip, the cheek, and actually, to me, and also to the patients, you can see the befores and afters, that they actually look younger.
Yeah.
It's almost like a little facelift because they get all that support. And especially if you're opening up the bite, because through the years, as the older patients, as you wear and tear in your teeth, all of a sudden the bite collapse, and then the lip area right here doesn't have that support. And then when you open them back up, you get that back up, and then they look, I think, significantly younger. And it's almost like getting some plastic surgery without the plastic surgery.
Agreed.
No, and to go over, so sometimes when we combine, like Dr. Silvestrini was saying, the outside, so the veneer, like we said, is a one surface, so meaning just what people see. That's essentially what veneer is. Now, when we wrap around that veneer into the tooth, that's when we want to sometimes increase the vertical, meaning that, like Dr. Barr was saying, you wore down your teeth, everything collapsed. Now you got to bring it back up. So then we will make our veneers wrap around. So it's just another type of porcelain restoration. Once again, that's something that your dentist, who should be well trained into doing this type of procedures, will determine what type of restoration you will need. But essentially, once it wraps, it's that we're increasing the bite, or there's a lot of damage that we need to repair that size, so we can extend the porcelain there. Once this porcelain is bonded to the tooth, it's one in the same. Even there's instances where we have to remove these restorations to replace the old veneers. I've had to remove some of my own veneers at some point, and I mean, I've had a lot of trouble taking this off. It's like I'm prepping the tooth all over again because they don't come off. There's sometimes instances that you try to like push them so they break, and then a piece of the tooth comes out with it. That's how well like they become one and the same, especially if you have a good bonding protocol.
Yeah, so with that, the bond strength or how the veneer adheres to your tooth, if it's an enamel, is the strongest possible. Yeah. Right? So one of the misconceptions that patients will have is, oh, if I grind or if my dentist told me I'm not a candidate for a veneer. Well, if done conservatively and if the technique is done properly, then that goes out the window, because now you're preparing it conservatively within enamel and you're bonding it in enamel. That is the strongest bond of any restoration possible, meaning that you shouldn't, in theory, be fracturing those off other than you chewing, very, very hard substances and fracturing your restorations, and not wearing a retainer or a night guard, which should be always recommended after a veneer case in order to protect not only the restorations, but for the patient, their investment in their smile.
And their opposing teeth also.
Sure.
Yeah, I think that we should also touch a little bit about composite veneers since we're on the topic of resin. I'm curious to hear everyone's opinion on them. So composite it's the material that a filling is made out of, and there are instances in which a dentist could make a crown out of it, either freehand or with a guide. And so it's definitely an excellent alternative, but there are pros and cons to every procedure. So since we're talking about resin, let's talk about our opinions on them.
So the main thing that I get with composite veneers is that a lot of patients get it, and their explanation of why they want the composite veneers is because they want something that doesn't damage their own natural tooth. It's supposed to be the most conservative. My opinion on it is what I tell patients. You should get what makes you, what's going to achieve the level of aesthetics that you want. A composite veneer, like we mentioned before, is always going to stain. It's always going to change with time. It's always going to wear, and you're going to have a lot of maintenance on it. Also, it's very, very technique sensitive. So if I were to do my veneers there's only one person in the US that I will actually trust to do it with. That's how difficult it is. And to find a practitioner that's very, very good at doing this, it's possible, but it's just very few. But sadly, we see a lot of patients that they choose that route because it's more economical. And then a lot of dentists do these veneers, and their main selling point to the patient is that, oh, we're not touching a natural tooth. Now, I always tell patients, okay, so if the maintenance on this thing is so high and it wears off after 3 to 5 years, you have to change them. There's no magical way of removing that composite from the tooth and not touching your tooth. So I am going to touch your tooth at some point. So that it's more conservative. It's not going to damage my tooth. I'm really going against that. I personally prefer porcelain. It lasts longer. You can make them as thin as you want. You can make them up to 0.3 millimeters. So you need to shave more of the tooth. That's not valid any longer with the ceramics that we have nowadays. And then with porcelain, like we said, we have that aesthetic that is more permanent. So it's not going to change over time in general. And then it's also going to reinforce your tooth, and it's going to give you an appearance that resin will not get there. You get a level of shine and a level of polish that you're just not going to get with resin. And the amount of details that you can put in it, it can be done with resin, but not very few can achieve that.
So to go with that, on our previous podcast, we did kind of touch this subject a little bit. It really, really depends on the patients and the patient's case. Okay, if the patient has severe crowding and they don't want to do orthodontics, resin veneers is not an option. Why? Because then you're still going to be removing tooth structure in order to put this on there. At that point, I'm always going to recommend the porcelain route. Now, if it's a minor touch-up, sometimes those are an option. Like if somebody has those smaller lateral incisors, which are the two teeth next to your two front teeth, some patients have what's called a peg lateral, meaning that they're smaller in size. Some patients don't want to spend the extra money or just don't want to do veneers on that side and want to do them out of resin, and that's a viable option. However, as Dr. Sanchez had mentioned, finding a practitioner that has the expertise and the technique behind doing them properly to look lifelike and to give it that real enhancement structure with the translucency and all the teeth vitality is extremely difficult. The number of practitioners that do this in the world are basically, you could count them in two of your hands, and we follow them all on Instagram, and it's extremely talented. Those clinicians are extremely talented in what they do.
And they're also charging you the same price
Exactly.
that most places will charge you for.
Yeah,
so at this point, it's not a cost effect, it's more of a personal opinion.
Opinion, correct.
Correct.
So
Yeah, and they're definitely not going to be as strong, and it's all case dependent. So as you guys can see, it's really important that a dentist takes into consideration a patient's bite. We are going to also be talking a little bit about orthodontics and how important it is to consider that as well, because the patient's bite, the function is very important when deciding on your dental needs, and also has to do with aesthetics. So thank you for listening to our second episode. We're going to follow up with our following episodes on different dental topics, and we look forward to speaking with you guys.
I'm Dr. Alfredo Arauz. My Instagram is dr.fedi, and I'm looking forward to seeing you guys on the next episode.
And I'm Dr. Melanie Silvestrini, Instagram, dr.melanierosalia.
I'm Dr. Oscar Sanchez, and my Instagram is dentistry by Oscar.
And I'm Dr. Santos, and my Instagram is dj2drbsantos.